Okay, can you see the screen? Yeah,
Yes, Doc.
okay. Let's talk. Ah, ngayon lang siya. Why? Okay. Kaya pala walang sumasalit. Okay. Um, okay, let's discuss pulse diagnosis as part of our auricular medicine um, topic, no? And even if you're good at ear acupuncture, you should also incorporate pulse and tongue diagnosis. Okay. So, pulse diagnosis is a fundamental diagnostic tool in traditional medicine, allowing practitioners to assess the overall health and vitality of a patient. And by examining the pulse, you can gather valuable information about various physiological conditions. The characteristics of the pulse, like strength, rhythm, and quality, can reveal underlying imbalances. This holistic approach helps to identify issues beyond mere symptoms. So this is very, very holistic. No? Incorporating pulse diagnosis enhances understanding of the body's dynamic state, promoting a more comprehensive view of health that integrates physical, emotional, and energetic aspects. So, what are the key indicators in tongue diagnosis? So, if you see a prickled deep red tongue, that means there is heat invading the yin or shui fan, suggesting potential internal conditions, heat conditions that need to be addressed. So if there's prickled tip of the tongue, so that means you see a lot of red dots there on the tip of the tongue. That means the patient has heart fire. Just like my patient this morning, um he has stage 3 esophageal cancer. So I was so happy because red na red yung tip. I told him, so yun.
Doc, prickled like strawberry
Yes.
prickled.
Although I'm sorry, but this one is not prickled. It's like cracked, no? But
Yeah,
anyway, if you see like the tip of the tongue is like
prickled.
may mga red prickles, no? Prickled tip, that's heart fire. And there can be potential emotional stress. So then we have if the center of the tongue is prickled, no, you'll see red spots there or papillae, spleen and stomach heat. Syempre nasa gitna, no? And then if you have a deep red fissured tongue, fissured may crack. Of course, there is heat impairing the body fluid. So that's actually dehydration, no? Or overheating in the body. Pagkatapos, if you have a fissured tongue and it's not red, it's pale, like this one. So there is blood deficiency, lack of nourishment, reflecting potential nutritional deficiencies. So this is where your expertise in nutrition comes in, no? Okay. What about prickled deep red tongue without coating? So walang coating. So there's so much heat already. So there's heat invading the ink fan or shui fan, which can lead to various health issues. Okay. So again, let's talk about pag heart fire. Um, the tip of the tongue is prickled. May mga pula-pula ka nakikita sa tip of the tongue. Okay? There are 1.2 million patients now who have spleen and stomach heat conditions. And nagastos yan. You feel hungry all the time. Around 75% of individuals exhibiting these symptoms also report digestive discomfort. 30% of those with spleen and stomach heat present with additional signs of heat-related issues. Okay. So deep red, the hindi pale. Fissured yung tongue, may crack. This is very crucial, no? Kasi this indicates heat impairing body fluids, diba? Dehydration. So, if the tongue is fissured, may cracks, tapos pale, there is blood deficiency or lack of nourishment. No? Okay. Now, what about pale and mirror tongue? Then you're proud because you can see your reflection there, especially when you look at your tongue in the mirror, no, in front of the mirror. So this will reflect severe deficiencies that may impact overall health and vitality. So a pale and mirror tongue signifies qi and blood exhaustion. So there is the major depletion of vital energy and nourishment within the body. Okay. A deep red and mirror tongue. So this time hindi siya pale. Mirror tongue siya pero deep red. That means the yin energy was significantly depleted in both stomach and kidneys. I think I made mention last time that when it comes to depletion of yin, always think of the stomach and the kidneys, no? And so this will lead to potential imbalances in body functions. 60% of patients will present with this kind of tongue. Okay. Hmm. Now, deep red rigid tongue. So that means matigas yung tongue, stiff tongue, no? Um, this indicates heat invading the pericardium. Remember, the pericardium is supposed to protect the heart. So this could mean that, there could be, like heat can lead to wind, no? So kailangan ready na, no? Hmm. Okay, what about a pale flaccid tongue? There is extreme deficiency of both qi and blood, highlighting a critical imbalance in the body's energy and nourishment. Now, the tongue color is deep red tapos flaccid with little coating. So little coating pa lang, nauubos na yung yin, no? Yin exhaustion. Okay? So indicating a lack of essential body fluids. So if you have a deep red tongue, flaccid tongue with dry coating, there is heat impairing the body fluids. Okay? So pale or light red, slightly trembling, nanginginig, no? So what does it mean? Qi and blood deficiency, or it can mean yang deficiency. That means there is lack of vital energy and nourishment in the body. And I remember I have a patient who loves to go to the gym, pero malaki pa rin yung ano. uh, I don't know saan napunta, no? Medyo malaki pa rin yung medyo mataba pa rin. So I noticed that the tongue was like shaking, no? So it was, the color is pale or even pink, but it was trembling, it was shaking, no? So that means pagod na siya because he would stay at the gym for 2 hours. Siguro, syempre nauubos yung pawis, no? So yun. So what about if you have a deep red, severely trembling tongue? Kanina pale, no? This one naman deep red. So, cause this is the time when you start considering extreme wind, no? So this is actually a warning that if you don't do anything about it, baka ma-stroke yung pasyente. Okay? So, what do you prefer? A pale red or pink trembling tongue or a deep red, severely trembling tongue? Anyone?
Wala,
Na,
Doc. Wala,
na,
wala. Wala.
normal.
Normal.
Napili ko lang kayo sa dalawa eh. You have to choose one. Siyempre yung pink.
Wala.
Oo. So next time nakita mong nanginginig yung dila, tinan mo ano ba, pink pa ba siya or deep red? Pag deep red na, nako, baka pwede
Malapit
ma-stroke anytime.
Lapit na
ma-stroke.
ma-heart attack.
Huwag
Mm-mm.
naman takutin. Tapos biglang Okay, we also know, and there's the presence of both chills and fever. This is an exterior syndrome. And the occurrence is simultaneous. Sabay siya, ha? So there will be thin white coating. This is normal. This is a strong indicator of exterior syndrome. So this is something to do with the body trying to fight the external pathogens. Okay. Now, what about if you have a thick white coating? Actually, pag masyado ng thick yung coating, that's very internal already, no? Malalim na talaga. So, and even if it's white, it can become heat. It may actually represent excessive heat already within the body's interior. So the thicker the tongue coating, the more interior na. And remember, even if cold yan dati, pag interior yan, it can become heat. Okay? Now, light yellow coating, mild heat lang yan. Okay? So, hindi pa siya that severe. Okay? Manageable pa. However, pagka-yellow niya masyado ng deep, that's severe heat. Okay? So, kailangan mo na talaga, it requires immediate attention. Okay? It can reveal deeper issues that have escalated and you would need more aggressive treatment to restore balance. What about if you have a tongue with a burnt yellow coating, nasunog na pa? I think this is also common, no? There's accumulation of it within the body, and this can lead to various health issues. Okay, Sir Mark, have you seen tongue na may gray and dry coating? Hmm.
May nakita ko po niyan eh, na parang gray, ganyan-ganyan. Nakakatakot.
No, ito presence of heat. Kasi
Yes.
parang nasunog siya, no? Alam mo naman pag nasunog. Or presence of yin deficiency. And this can lead to internal fire. Okay? So gray and slippery coating. Gray siya tapos slippery. Cold damp. Cold damp siya. Damp, slippery. Oo. Kaya depende. Pag basa-basa ng konti yung, or medyo moist or wet yung tongue, that's cold. Cold damp. No? So accumulation of dampness and cold. Okay? O ganyan ang itsura ng extreme heat. No? Oo. Huwag yung bigla ka natakot. Kita mo naman, if you can if you can observe the prickles, no? Hindi siya pula, maitim na siya. Extreme heat. Now, yang deficiency, okay, papiliin ko kayo, extreme heat or yang deficiency? Nang lalamig.
None. None.
Pa rin, ang yayapang.
Mag
Ano perfect? Okay.
Magayang ka muna bago ako mag-extreme.
Okay. So napaka-importante po ng coating, no? So a thin coating is normal. Thin coating, pwede rin exterior syndrome. Okay, thick coating, interior. So when you are treating a patient, ako una-una ko tinitingnan kung if uh, the coating is thick to start with, if you know that your treatment is correct, you should see parang numinipis siya, no? Minsan kasi nagtatagal ng 45 minutes or 1 hour yung patient. Tingnan mo ulit. May konting pagbabago siya, no? Minsan iniisip mo na lang. Okay. What about sticky coating? Yun napapaiyo ka talaga, no? So that means there is turbid condition. There is phlegm and dampness. Okay? It appears greasy. And even if i-brush mo siya, ganun pa rin, walang nangyayari. So the importance of tongue diagnosis in health assessment, it can provide us valuable insights, no, into the underlying health issues. And this will enable more effective treatment plans, especially if you ask your patient to also take a picture of his or her tongue. And then mag-friend kayo sa Facebook, like, yun. Kaya he will keep coming back to you kahit once a month or every 2 months or every 2 weeks. Diba? Thank you so much for listening. So now we go to assessment.